Everybody, good afternoon, good evening.
And good morning.
Well, in some areas of the world, yes, that can happen too. This is Dr. Shiraz Farooq and Sydney Farooq.
Hi, how are you? Thanks for joining us.
Thank you very much. We are at the DaBootyDoc Talk. I'm a board certified colorectal surgeon. This is my spouse, Sydney Farooq, and she's double qualified. Absolutely. She manages me. So,
no medical advice over here on my end.
Correct. We are here to educate you and make you laugh. You know why? Because the booty talk is the best talk out there in town about your bum or your bottom.
So whatever you got, let us have it.
Absolutely, guys. Thank you very much for joining in. I am very happy that we have some repeat customers or repeat audience. Today's topic is very interesting, very exciting, and a lot of people ask me about it, so I thought I should put it out there. What happens after surgery?
No, specifically hemorrhoid surgery.
Well,
so
bottom surgery or anorectal surgery or hemorrhoid surgery.
Okay.
Everything gets clobbered or put together into the hemorrhoid basket. So what happens before hemorrhoid surgery and what happens after hemorrhoid surgery is concerns of everybody. Today's topic is after the surgery, chop chop, what do you do?
It sounds so fun. So post-op, what do you do if you have anorectal surgery? Specifically, we can focus on hemorrhoids, I guess, a little bit.
Well, the first thing you do is you take a deep breath and relax. Okay, you're in very good hands. If you've had colorectal surgery, you've probably been operated upon by a board-certified colorectal surgeon, a general surgeon, a plastic surgeon, or somebody who has been doing it for a while and they know what they're doing. So they'll be able to help you recover and get better and back to your life.
That's right.
So anorectal surgery is a big deal. Everybody is scared of it. We have seen thousands of patients go through this with a grain of salt. They are afraid, they are scared, but we are able to help them, guide them, and teach them how to recover and get back on their lives. Yeah. So it's very important that we give out this information in a friendly manner to all our patients and the public out, so that the stigma of hemorrhoid surgery and anorectal surgery is minimized.
Yeah, so expectations are best met with education. So that's what we do.
Yes,
I just made it up on the spot.
So we are here in Tampa, Florida. Colorectal surgery is my forte. Colowell America is a surgical practice that we are here to give some education about. And today's topic for the people who are joining in is post-operative recovery after anorectal surgery.
That's right. So let's jump in. If you haven't joined us before, again, this is the DaBootyDoc Talk with Shiraz Farooq, doctor board certified for colorectal surgery in Sydney. We're in Tampa, Florida, and I'd like to hear what you have to say. What do you expect after surgery?
So I like to tell patients all of this information when we meet them, and we like to divide it into phases. So after surgery, the first phase is immediately when you're recovering in the recovery room. You're groggy, you just got wheeled out of the operating room, you may be in some pain, but most times patients are asleep or they're mumbling or laying on their side. It takes them a couple of hours to recover. During this time frame, the anesthesiologist and the hospital or surgery staff are going to make sure that the patient is able to void, is able to talk, able to walk, and able to go home.
So going into the surgery, there's usually anesthesia involved. So
correct.
They're coming out of anesthesia, recovering from that first couple hours.
Absolutely. So anesthesia could be local anesthesia, could be regional anesthesia, or they could get general anesthetic medicine that will make them sleep through the operation. And then there's a recovery period to go through that. So after getting out of the hospital bed or surgery suite, they are going to be going home and be picked up by somebody who's going to take them home.
You do not get to drive home. Sorry.
Correct. So that's one of the things we want everybody to know. You're not driving home after anorectal surgery. You are going to be in pain or not, but you'll have anesthetic medicine on board. So don't plan on driving. It's worse than drunk driving. So no. Have a friend or family member pick you up. You should wear some loose clothes. All your belongings will be put in a bag, and you will be going home with some medications, some instructions, and hopefully a follow-up visit will be planned for you.
Hopefully.
Well,
Definitely.
yeah, definitely, most of the times. So
leaving the hospital, you're usually still medicated. You're
correct.
usually not in much pain. In fact, doctor will talk to patients sometimes hours after. They're like, I feel great. We're
And-
like, wait a minute,
And that can happen.
it's coming.
It's coming, and some patients will get anesthesia medicine locally that can prolong the anesthetic for up to a few days. And these new medicines are fantastic. They can inject some special local anesthetic that stays around the perianal, around your bottom area for up to 48 to 72 hours in some cases, and can give you some relief and numbing sensation.
Now, what he's talking about is specific, that's medication that's planned for.
Correct.
So this isn't your typical post-op experience. Usually your prescribed medications you get from the pharmacy either
Correct.
before or after your procedure, and you use that for pain management. But you can utilize an injection that allows the area to stay numb for up to several days.
Comfortably numb, guys. That's what Pink Floyd talked about, and sometimes giving the patient
Different injection.
yes in the brain.
So that's something additional you can look into if you're considering surgery. You might see what other options there are for pain management, which is something that we definitely want to talk about today.
Yeah,
too.
so pain management after anorectal surgery is a big deal. We hear a lot about it. Patients are afraid. There's a general fear in the public. I'm telling you, this is real. Patients come to me. My dad had hemorrhoid surgery. My uncle had it. Some Joe Schmo had it, and after that, they almost died. Or they had worse pain than a baby, and they are afraid and they are scared.
When you say almost died, do you mean because the pain is so bad?
Yeah.
Were you just making like a reference?
Yeah, I was making a reference because patients
a metaphor. The pain is so bad.
So patients are scared. So when they come to see us, they are trembling in fear.
Mm-hmm.
And we have to tell them, have no fear.
So if you know someone who's, sorry, the booty doc is here.
Yeah.
I messed up your joke. Have no fear, the booty doc is here.
We take care of your rear.
But if you know someone who's had anorectal surgery, they're gonna tell you it hurts, and we don't sugarcoat it either. Like when we're signing you up, we're like, be prepared for some bad pain.
This is something that is going to require multi-level pain management.
Mm-hmm.
The pain management could be narcotic medicine, could be non-narcotic medicine, could be something that is a neuromodulator, so you could get a muscle spasm relief medicine. You could have oral medicines, you could have injections, you could have creams that can help, and sometimes medical cannabis can help. This is off-label, but that can also help.
True.
So there's a lot of different options for patients to have a combination treatment that will allow them to have relief after surgery. The area is numb, is raw, there's anal spasm, so you hurt a lot.
Yeah, even some of the concerns afterwards are because of the swelling in the area, you may not be able to defecate or urinate.
Hold on, what does defecate mean for the public?
Poop.
Poop, to poop or not to poop.
So if you don't have a bowel movement immediately after anorectal surgery, that's actually normal.
And that actually happens because you have anal spasm. The operative site, meaning the bottom that we just operated on and we cut into or put sutures into, is going to be very sensitive. It is a muscle, and if you touch a muscle or you bruise a muscle goes into spasm. It doesn't move. Like if you have back injury, your back locks up, your muscles are very tight. So, or your neck injury and your muscle and your neck may get very tight. Same thing. With your anus, it gets very tight. You can't move.
In that case, it's not going to allow you to use it.
And you're not going to have a poo-poo.
And this might also affect the urinary tract as well.
And the PP may be a problem too. So
our viewers must be little toddlers today.
Well, we have to understand that most of the public wants it in layman terminology, and
so
I can
pee
say
and poo poo.
I mean I can say
no.
I can say defecation and micturition, but a lot of people may find that Latinized.
So it's normal if you can't use the bathroom, but this should only be normal for a short amount of time. So
Correct.
after a
So,
couple days, you should
No,
be.
no, hold on, before you go there. So urinary retention is a big deal.
Mhm.
In some patients, they cannot pee after surgery, and this may happen in up to 1 to 6% of the patients.
Mhm.
These patients, after surgery, that night, even if they avoided at the surgery center, they peed at the hospital and they went home, they may have swelling, they may have pain or discomfort, and their bladder may not work. And the bladder may not work because the nerves in the area are inflamed and irritated. So these patients may get a bladder distension, may have to go to the emergency room, and may have to get a catheter placed inside their penis to drain the bladder and give them immediate relief. So it could be the vagina also, yes. Well, the urethral tract, yes, you're right. So in that case, urination or able to pee is very important because the first day we would like you to pee. So that's why in my practice, I like to talk to my patients in the evening, find out if they're doing well or not, and we can direct them appropriately.
So usually if patients haven't urinated by the morning, then we ask
Well,
them.
by that night, if they haven't, then they probably have to go get a catheter placed inside.
And again, it depends on time of surgery. So
Correct.
we're referring to our patients in particular, they usually are operated on in the AM before noon. So if in the evening, dinner time,
About 12 hours later, if you're not able to void or pee, then that's a cause of concern and you should look it up.
but simple
and call for
solution,
medical help.
you get a catheter placed, it can come out in a couple days and
Well, before that, patients may try to stand in a shower, may massage. Sometimes they lay down, stand up. It's very uncomfortable, guys.
so you can try to cause your body to urinate by
Correct.
staying in a warm shower. You could massage the belly area, try to loosen it up,
You can
but
try to hang upside down. Does that work?
ask your partner to flip you upside down.
I don't know if Batman would agree with that.
That explains so much.
So,
But
so-
then
so-
to make sure that you're able to poo poo,
And the poo-poo may not come for 2 days or 3 days. And that's a big concern.
we know that ahead of time. So
Yes.
we typically prescribe that you take Miralax or some stool
Well,
softeners.
we want patients to go. So there's a couple of things that have to happen. We want them to get a laxative of some kind that's gentle, that allows the diarrhea-like movement to happen. We also give them some fiber. So that those two things combined together may allow the inflammation and swelling to go through. And as the days go by, second day, usually second or third day, you have a bowel movement. that
So
happens.
this brings me to a question too. Should I change my diet?
Yes.
I mean, I gotta poop it out and
So
I'm putting it
important.
in. I just had my butt cut. What am
Butt
I gonna
cut.
do?
So after a butt cut, guys, what you need to do is add more fiber. Okay, this is so important. We tell everybody in our practice and we tell all the world about fiber all day long. But after a butt cut or anorectal surgery, you really, really need to add extra fiber. You know why? Because that fiber will then allow the bowel movement to come through. It acts as a sponge. You have to drink a lot of fluids with that. So increasing your fiber intake after anorectal surgery is so important.
Also, fiber helps with consistency. So
Correct.
you want to pass soft stools. You don't want diarrhea, so
Or-
don't take diuretics, but you do
No.
want to have a regular bowel movement that's nice and soft.
Diuretics will cause you to have a lot of urination. And diarrhea-like medicines would be laxatives in that case. So that would help.
So I'm not a doctor.
But it sounds very right. Okay. So correction made here. So
don't
take
take
laxatives.
laxatives is what I was
Well,
trying to say.
Don't take too many laxatives. You may have to take some laxatives to make the jump start.
Mhm.
So in my practice, what I tell people is to take a tiny bit of laxative, more fiber, start the process, and if you need more laxatives, you can, but be careful. Why? Because then you will get the runs. And if you get the runs, that means that you go into the bathroom 10 times a day after surgery,
Not healthy.
not healthy, you're gonna open up the wounds can get infected, you
Not
can
hygienic.
get irritation, hygiene issues, all those issues.
Mhm.
So finding a balance between too much poop and too little poop is so important after anorectal surgery.
And this is why you should consult with your doctor.
Absolutely.
And
That's
make
where,
sure you have your educational materials in advance,
And
know
your-
what you're doing.
and your post-operative instructions will explain some of that. A lot of doctors have information out for the patients. There's also information online. Another thing you have to do, anorectal hygiene. So important, guys. Everybody asks me about that. Do I take a sitz bath? Do I put Epsom salts on it? I get this question every day. You know why? I tell them, why don't you put some pepper and chilies in it too?
Mm-hmm.
You're not cooking, guys. You're not making a hot pot. You need to wash the area. You can use sitz baths. You can use warm water, but really no need to
What's
put
a
any.
sitz bath?
Sitz baths, I like to tell people, is like a mini hot tub for your body.
So the sitz bath is not the concoction; it's just water.
It's in a
But
bowl.
it's in a small container to just soak your rump in.
The rump soaking device sits on the toilet, and you have your rump in it, and you have a Humpty Dumpty time.
So I think that's where people get confused. They think sitz bath is something like an Epsom salt bath. So they think it's something that's chemical or medicated.
Sometimes they put medications and Epsom salts in it. I've heard people put all kinds of herbs in
But you
it
just said
and
that's
stuff.
not what we're doing.
We're not cooking, guys. Don't put pepper, chilies, salt, spices.
So the
Don't do
sitz
that.
bath is the actual bath
Device.
unit. And then we recommend just water.
Just warm water, it'll clean you out. You can also pad dry. Another thing that really helps, I've found out, is ice. So ice packing or ice in a Ziploc bag or on a towel, if you allow that on your bottom, can also provide you soothing help. So definitely do that. Warm and heat. So warmth and heat together work really well to decrease swelling.
You mean cold, hot and cold? You said warmth and heat.
Oh yeah, warm and cold, yes. Yes, correction.
Or you can do different variations of warm.
Correct. Well, yeah, that would be warm and cold. So after you've done the hygiene, and you've taken fiber, and you've taken your doctor's medications, another thing that you have to do is not move around a lot. Take it easy.
Yeah, you want some advice for pain management other than taking your medications and staying clean and everything. You don't want to do too much.
Correct. You can sit
Activity
down.
low.
You can sit down. You can put your tushy on a donut or a croissant or a pillow of any kind. It's all okay. What you want is to rest your bottom, and you can lay on your side. You can lay on your stomach. You can stand up.
So
But don't go skydiving.
it's good to know that, like,
Right.
yes, you're going to be able to stand up, walk around, go to the bathroom by yourself. But you shouldn't be like doing the dishes or house chores. Don't go to the gym. Don't ride a bicycle.
Yes, that's a very important thing. I've had so many people tell me, Doc, how soon can I get on the bike? I'm an avid biker. I can't stop biking and I want to be on the bike next week.
Well, how soon do you want to be back in that situation again?
That's a good way.
So you might have stitches. They're going to dissolve on their own, but they might break. That might cause the wound not to heal as nicely. It might not damage anything, but you won't have as nice of a wound heal. It could lead to more prone to infection if the wound's opening up. You might need another surgery if it doesn't heal properly. So there's risk of that.
I tell people that think of your bottom as like being in this core of your body, which it is, okay? So that's the total core of your body, and if you move in any direction, your core is going to move. So you want to limit the positions that you are so that your bottom has time to heal.
Mm-hmm.
You know, most healing happens with approximation. Approximation means that the wounds are close together so that the body is able to glue them together and heal. And if we are moving around a lot and doing things like running, biking, going back to work too soon, not, taking care of your dog or children, and not planning ahead, that is important.
So send your kids to grandma's house. Get rid of the pets. You don't need them anyway. Just kidding. Boarding school for your pets. But I really tell people just like milk this. Like, come on, let's be real. You had a pretty serious operation. Even if it's a small little thing, it's your anus.
Do you know Napoleon had to postpone his invasion because he got hemorrhoids?
I wonder why.
Yeah, so postoperative care is very important, guys. Postoperative care will allow you to go back to your life quickly. Okay?
That's the thing. Spare a couple of weeks at least to heal.
That's what everybody asks me. How long is it going to take, Doc? And I'm like, how long do you want it to take? You want to recover quickly, fast, then follow instructions.
Because if you have post-op complications, you're going to be back in the office and you're going to be needing follow-up. You might not get where you want to be as quickly. So the most you can do for yourself in the beginning is
rest.
Take it easy.
Take it easy. Slow down.
Time off work. I know nobody has time off work. There's leave that you can apply for. So if you have some type of workman's comp or medical leave,
yes,
utilize
taking
that.
time off from any surgery is important. Anorectal surgery is very delicate. It's a very sensitive area. Be kind to yourself. Relax. Take some time off. Hydrate yourself. Eat fiber. Take the pain medicines. Ice it. Use sitz baths. You can apply some creams. You will get better.
What if you don't have anyone to help take care of you?
That's a tough one. We try to not, we try to help patients get better, and sometimes they can be other people who can call in them, and sometimes insurances can help with having a nurse come in to see them. So there are options.
There's home health care. So if you're wondering, and it doesn't have to be for retired people or the elderly, the incapable only. If you need help changing a dressing on an area of your body that you're not familiar with, you can't reach, you can get home health care as well, where a nurse, someone who's trained medical professional, comes to your house and helps you, and they have your post-op instructions or in communication with your doctor.
And also it is important to not only follow your doctor's instructions, follow them, and also come back to your next visit. Because your doctor needs to see you, evaluate you. This usually happens about the second week or so. Sometimes we call the patients in earlier because they may have an issue that needs to be addressed. But a lot of times we would like the swelling to go down, the pain to get better, and it takes time, guys. This is somewhere where we don't sugarcoat. There's a 1 to 2 week period that you're going to go through a rocky time. If you prepare for it adequately with preoperative care, medicines that you need, foods that you eat, you can do a lot.
So going into surgery, I mean, you'd probably have some type of pre-op visit where you're getting educated on what the procedure is going to be. You're getting those materials that you need. Maybe you're getting your scripts for your medications. So from there, then you know your surgery date. Go get your medications from the pharmacy ahead of time. Ask your questions then. Maybe something isn't covered by your insurance and you need a different type of antibiotic or this or that. Solve all that. Get that out of your way. Correct. Plan a ride. You know you need a ride, and you're going to need someone to help you those first couple of days. Get family member, maybe a neighbor, a friend, someone who can come help take care of you during that time.
Eat better, nutritious foods, add fiber.
Go shopping. You can't shop while you're stuck.
Correct. That's a very big deal. I tell people.
Get the high fiber foods, get the flaxseed.
Here we go, guys. It comes here. Okay. Ground flaxseed is an amazing food. Very cheap, available everywhere. You can put it in yogurt, in smoothies.
And you can start taking it before your procedure.
And very important.
That's going to get your bowels more regular prior to your procedure. Then you can continue and maintain it. Your body's already got the movements going.
Probiotics are very important too. And yogurt is an amazing thing for that, guys. You can add yogurt, you can take plums, you can do a lot of things to help you.
So in your pre-op visit, you can ask your doctor, what foods do you recommend? Go get those foods, have them at home. Have plenty of hydration. If you only drink a certain bottle of water, stock up on it. If you hate water, you have something else, stock up on that.
I also tell people don't smoke. Don't drink alcohol, take it easy. Nicotine causes the blood flow to decrease at the area where the operation was done. So minimize nicotine, alcohol, soda. You also want to minimize spices. I mean, a lot of people ask me, Doc, do I eat spicy food after surgery? And I'm like, you're gonna get a cut in the bottom. The bottom is gonna hurt, and spicy food may irritate it. So minimizing spicy food may not be a bad idea.
Yeah, so give it up. Whatever it is
Yes.
for a couple weeks. And the first week post-op, you're gonna be in pain. You gotta stay on top of your medications.
Well, if you can manage it properly. I mean, like if you can manage
That's
it,
what I'm
I think
saying.
a lot of people can overcome their pain and recover. But
So that's where it's critical
It
that
is
you
important.
follow your post-op care instructions. If the doctor prescribed you 4 medications, you got an antibiotic, you got a muscle relaxer, you got a couple pain medicines, then those need to be taken certain times a day. Make sure you know what to take when, organize yourself so that way you're not in pain because you're on top of the medications, you're having the proper bowel movements, the right consistency. So all of those little details will add up. We talk to patients sometimes afterward, did you get the flaxseed?
no, a lot of times fiber is one thing everybody misses out. Okay, they go through the surgery planning and all of that, and they forget that they have to do an extra fiber, especially after surgery, guys. We want you guys to understand that your bowels are not going to move. You need help, and adding a boost of fiber will really make a difference. So add that there. Be gentle with your body. Take it easy. Read some books. Sleep. Very important.
Very important, get
Okay.
that sleep.
Get that in. Anorectal hygiene, please. Keep the area clean. You don't need fancy tuxes and medicated medications
That
and
might
other
irritate
stuff.
it or
You
break
just-
down the wound.
Just
again.
need to pad dry it with water and with just a toilet paper afterwards. Keep the area clean. Sometimes patients can use over-the-counter medications, Neosporin, petroleum jelly-based products are okay, but we don't want you to use a lot of stuff. You want the wounds to be almost dry, not too wet, and clean.
And different chemicals and things too could break down sutures faster than they should be or cause irritation. So you want to always inquire with your doctor before using
Correct.
anything.
So-
Usually they're going to recommend nothing for the first couple weeks.
So that's one where your doctor, your nurse practitioner, your physician liaison comes in very handy.
Yeah, utilize them after
Be
surgery
in touch with them so you're able to have
and
access.
go to
get better.
your post-op. So
Yes.
a lot of times patients call and they cancel their post-ops because they're like, well, I don't know if it's getting any better or I can. If you don't know, then you should come and we will find out and be able to tell you. So if you have any concerns about the area of the wound, the best way to know is to see it.
Yeah,
So-
and that's where they can't see it because
So-
you can't twist yourself upside down. You can
And
use
you
a
don't know
camera.
what you're looking for maybe too. A lot of times there's swelling in the area, it looks really ugly, it's gonna heal over time, though that's what you don't know. You don't have the foresight and the experience like the experts do to know what's
And,
going on.
and after anorectal surgery or hemorrhoid surgery, there is swelling. The area is the most dependent part of your body.
There's a lot
Area
of
has
pressure going on
loose
there.
tissue. The fluid is going to accumulate. It'll look like a sore pucker, a big swelling. It may bleed. It may drain. All of those things may be normal or may be abnormal.
So come to your post-op appointments to find out
Correct.
if the healing process is going well. And if not, then that's our time to act. Do we need antibiotics? Do we need to do another stitch here
Have
and
we
there?
missed anything in the post-operative care for our patients?
No, I mean, the other thing I was gonna emphasize is that after the first week, every day gets a little bit better.
Correct,
So week number
yes.
2, you're on the up and up every single day. You're gonna come out of it, but
Not
still,
everybody's different. Everybody's the same. Some people go faster, some go slow. So
everyone's surgeries are different.
so take it
we're
easy.
we're generalizing a lot of different things here, but just have that positive outlook. But then remember,
Yeah, that's it.
after you get a little bit better and you're feeling better, still baby it. We're not going to play basketball
The
and
last thing
stuff.
I'm going to say, positive attitude.
Get
Okay?
that good energy.
When you are wanting to heal your body and you pay attention to everything and you stay hopeful and you make positive incremental efforts to improve yourself, there's a very, very good chance that your body will listen and it will try to heal you. So please do all the things we're talking about, read up on this,
Yeah.
and stay positive.
All right, so we're out of time at 7:30. Thanks for spending this half an hour with us. We'll be back next week. So every Thursday, 7:30, got the Booty Doc Talk here with Dr. Farooq and myself.
Thank you guys. We appreciate you being here, and keep us in mind and give us your
Stay well.
questions.
If you're considering anorectal surgery,
Don't be bummed out. We can help you with that.
that's right.
Take
so
care.
find your doctor soon. Have
Thank
a
you.
good night, everyone.
Yeah,
Thank you.
thumbs up.